So I've been in long-term recovery since November 23rd, 2018.
I have been in recovery for 7 years on June 22nd.
Congratulations.
Thank you.
My recovery date is August 10th, 2018. So I believe this year will be 7 years.
Stigma associated with pregnancy looks like being asked questions that are uncomfortable. It looks like picking up on judgment or feelings from another person and making someone feel less than or unworthy of receiving care. Or it could even be a situation where it just causes someone to be on high alert and not being able to enjoy the present moment, especially when having a baby. That's supposed to be one of the most joyful times in a mother's life. And when you don't see that joy or feel that joy, that I would say is usually a stem of stigma that mom's feeling.
To me, it just looks like people having their own judgments, maybe from their experiences in life or from their lack of experiences in life. We only know what we know. And so sometimes people aren't willing to ask questions and therefore they're just stuck in that mindset. But so the stigma comes in by judging these moms and then therefore giving them less care or assuming that they don't have their baby's best interest in mind or that they don't want to stop and things like that, when that's usually not the case.
Punishing the individual, maybe belittling them, giving misinformation, and not using inclusive language.
The most encouraging thing someone said to me during pregnancy was, "You can do this." It was a friend that I had struggled with in the past, and for several years we had struggled together, but I had watched her join family treatment court. I saw that she was getting to interact with her children, just making big changes. And so she told me this many, many times, but one day she came and she said it, and she told me, "I know that you can do this because I did it." And that day it just stuck.
It was actually after my youngest son was born. I was in recovery. My youngest son was adopted. And my drug court director, she's like, "Well, what matters is who he finds when he comes back." So that's something that I've held on to for the last several years. Is she's like, you can either go back to what you used to do, or you can use that and you can keep going forward. So that's what I've held on to. As working in the NICU or working on mother and baby, I think there's been a lot of growth in the stigma reduction, but it's taken a lot of work to get there. I didn't really notice a lot of stigma until I started working here and all what that looked like. And I've supported peers that are on MAT or MAR, who they face stigma in the hospital while delivering their baby. And I think that it's just there, and we're just trying to change it.
So the pattern that I see of stigma is typically, for one, mom is scared. Sometimes she gets prenatal care, sometimes she doesn't. There are situations where social work comes in and sees moms. They ask questions that will make anyone uncomfortable. And then from there, depending on the judgment call, if it could be judgment call, it could be by the book, you never know. Then they have to worry about outside referrals and the impact that that's going to have on themselves, their baby, their entire family.
I have seen an increase in stigma for sure. I've seen an increase in stigma towards pregnant moms, but also towards women who are trying to breastfeed. Maybe they just have a history of substance use and they were negative on admission, but there's some discouraging towards breastfeeding. I think that the most important thing to avoid stigmatizing pregnant women or anyone in general is just to practice intentionally not knowing. If you don't go into a situation assuming that you have all the answers, then you're much more likely to ask questions and to get to the root of things.
Language, for one. Always use person first language. No matter the feelings about a situation, how we talk to people is probably the most impactful way to connect with someone and not make them feel stigmatized. Never referring to someone as a drug addict or an ex-addict or a junkie, but more in the terms of this is a person struggling or experiencing substance use disorder.
More protocol as far as these are the questions that we ask, no offense in the questions, and then just like an appreciative inquiry. And it's not really just about like what have you been using or what are you doing, but how are things going in your life? What else is going on in your life and things like that.
Practical tips to avoid stigmatizing pregnant women will include inclusive language, trauma-informed training. I would also say empathy and compassion goes a long way. And being a decent human. Also exposure to others with like maybe situations, as well as just being involved in general.
Instead of taking the punitive approach, take the person-focused, person-centered approach, because if we have a healthy mom, we will have a healthy baby.
Not from anybody. I think it was me stigmatizing myself. Because I was so new to the using. I've never really done anything until my youngest son. So it was all very new for me, not knowing what I was going into at delivery and all of that. Thankfully, DFACS didn't come in until after he was born, when the use got pretty bad. But I think it was more so just me, not really anybody else.
I did experience stigma during my pregnancies, specifically the last two. I was on MAT medication before I found out I was pregnant with my second daughter. And then when I told the MAT clinic that I was pregnant, they automatically made me sign a paper saying that I would continue treatment, would not stop, and they just wanted to increase my dose. And I guess they were just basing it off of like best practices and not individual care, because I did not want to increase my dose, things like that. So I really felt stigmatized by the MAT clinic at that time, because they just took charge completely over my medical care and left me out of it, just based off the fact that I was on MAT medication. You know, they weren't factoring in that I had the desire to lower the dose and things like that. But then also, of course, at the hospitals and with the doctor, because I'm a person who now every time I go to the doctor, it says opioid dependent on my records. And it still says that to this day, which is very discouraging, because I know every time I see a new doctor, I'm going to have to explain that. And also, they're not really going to listen to me, because they just sort of see that one title. They see that one diagnosis as who I am. And that's been really hard. I
have experienced stigma during pregnancy from peers within my community. Absolutely, from medical staff. It's pretty consistent. I don't know that they are fully aware that they are being stigmatizing, but it's usually the same. Someone calling me a addict or non-compliant. That's a really big one within medical staff. Someone saying she's non-compliant. Not non-compliant, I just don't like what you're telling me to do. There's a difference, you know? I don't feel safe in doing what you're asking me to do versus I just don't want to do it.
For both of my kids, I never tested positive on admission. With my oldest son, I just smoked marijuana. My youngest son, I only did that once or twice. About 6 or 7 months in, I started using Adderall. After he was born, then it went to methamphetamine. But I feel now that I'm out of that, there was a lot of domestic violence going on, and I think my OBGYN knew that. If I knew then what I know now, I definitely could have been honest with her and had the support that I needed, because she's followed my recovery journey from day one, ever since both of my kids have been delivered, and she reaches out to me to support some of her patients now. So it's really kind of full circle with that.
It could take a toll on them mentally, where they need counseling or their village to pull in even more. Physically, that can look like maybe rights taken away if they have children, maybe even more tests given at appointments, and just the overall being shunned in a supposedly safe setting.
As a peer coach, I've watched a lot of moms come through there, and they're already feeling bad about what's happened, that they've been using, that this is how they're living, like all of these things. And when you go into a hospital setting, nobody makes that any easier. And even if nobody's saying anything, they automatically feel judged. They already feel bad about it. They already feel like they're a horrible mom and that they don't deserve their babies. They're already expecting defects to come in. So I think just being aware of those things and sometimes just sitting with them is really what they need the most, because when they already know everything that you're telling them, and it just makes it that much worse when it all starts to kind of play out. And a lot of moms come in there and they don't know that you're gonna test them for any substances either. So it's like a culture shock for them, and like their world's falling down. So I think them being able to have the support would change a lot of that.
Now, if they're going through stigma while they're using and they're pregnant, what do you think is going to do mentally?
That they're worthless, useless. They already know how this is going to end up. Nobody cares about them. That's what would have went through my head. Disappointment, because a lot of our families don't know that we use. My dad didn't know until the very last minute. And my mom knew, but my dad never did. So it's like all of these things are fixing to come out, and you're worried about how you're gonna handle those things.
It's going to impact that person probably the most. However, it will have a ripple effect into the family feeling the stigma, the family questioning. The family may not even know, but questioning, why is my child being treated this way, or why are they asking my child these questions? Or sometimes babies are taken out of hospital rooms, so that will then raise a question: why is the baby being removed from the room? What are the concerns? Because the family may or may not know. And then also, is the baby being removed for personal stigmatization or assumed situations? There's lots of things that can play a role. Inconsistent view of the situation, because you have some people who are like, that baby's having withdrawal symptoms right now, that baby needs to go to the NICU, whereas some aren't so overly focused and actually seeing things for what they are instead of what they assume them to be.
Stigma towards pregnant women definitely affects the entire family, and then just the community in general, I believe, because if a mom is stigmatized against, then really the whole family is, because that mom is less likely to seek treatment. She's less likely to reach out for support. She's less likely to engage in community activities. Therefore, her children are less likely to engage in them. I think it's just a trickle-down effect.
Instead of taking the punitive approach, take the person-focused, person-centered approach, because if we have a healthy mom, we will have a healthy baby.
They can avoid stigmatizing women by asking the same set of questions to every woman. And it takes more than just a checklist that you get in your new patient forms. I think that it takes an actual person sitting down beside you, taking the time to ask those questions, and then to show like to show that they are curious about your answers?
I would just make it a safe space always. And I would caution providers to also make it a safe space. I think that is vital in making sure we reframe and just release the use of things that doesn't serve that population and ourselves. I would also, as a doula, make sure I'm taking clients no matter what their backgrounds or factors and things are, so that I can make sure they have effective support and a desirable delivery in pregnancy.
I'm very high alert when I use my language. I want to make sure I'm using language to connect with that mom. In the past, I have said stigmatizing language not only about other women, but about myself as well. Having that experience, yeah, I've absolutely used stigmatizing language. And in the past, I think I viewed it as normal. And today I realize I shouldn't speak like that about anyone, myself or anyone that I come in contact with.
I have not used it. I have also just been more leery to converse to avoid using it. So I might have been standoffish to not put myself in a situation to offend or belittle.
I've called myself an addict. I've called myself a junkie. I'm a horrible mother. I don't have the capabilities of being a good mother. I deserve to be where I'm at right now. Just, negative self-talk will lead to negative language for myself and others.
I definitely just want to tell anyone out there who's struggling that it doesn't have to be that way. You are not alone. You just have to find safe people to talk to. I know how intimidating it is to go to a doctor's office and say, I have a problem and I need help. There's very few of us who are willing to do that, or even if we are willing, we may not get the best response. But there are people out there who can help you, and I would encourage those women to find local RCOs, and that might be your best shot. That's a recovery community organization. So there's lots of people there in recovery who are willing to help connect the dots for them and just love on them.
The main thing I want to say is that to all mothers, you are loved, you are valued. If it's not happening within the circle of people that you're in, find a different circle. There are people out here who will love you, and I'm one of them. We're here, always here. I value you.